Hello, I'm Dr. Sanjay Panicker. I'm the founder of Amrita Homeopathy. We have two clinics, one is in Korumangala and the other one is at Marathalli in Bangalore. We specialize in hair and skin problems, respiratory problems, allergies, pediatrics and infertility. I have also authored a book on pediatrics. Yesterday was the book release. This is on pediatrics drug pictures, that is, it gives an idea about how to prescribe for children. And it is an illustrated book with a lot of pictures in it so that it's easy for doctors and for others also to understand how to prescribe in pediatrics. Homeopathic medicines in piles, fissure and fistula most commonly used is Nux vomica, peonia, natrimur, fluoric acid, sulfuric acid, sulfur, calcarea, lycopodium based on the symptoms of the particular patient. So if the patient has an ineffectual urge to pass motion, then probably Nux vomica could be one of the remedy. If he has a very sharp cut fissure and then he is not able to pass motion, then probably peonia and Nux vomica could also come up. Again, symptoms we have to differentiate based on the tongue and the presentation, the motions, the quality of these stools, whether he is having thirst, whether he is not having thirst. There are multiple modalities which we need to take into consideration before we prescribe. So in homeopathy, actually there is no best remedy. It is only the remedy which is for that particular patient that we need to understand. The same remedy for another patient may not work. And it is not a good practice to prescribe my medicine to somebody else. Like for example, now I am telling you, okay, Nux vomica is a good medicine for piles. I am prescribing that to you. Now when you find somebody else who has piles, your heart melts and maybe you want to help that person and you prescribe Nux vomica for him. And that patient may end up in disaster. Like for example, I had a patient. We know that during COVID, arsenicum album 30 was prescribed repeatedly. One dose was given for 3 days and it worked as a wonderful preventive during COVID period. Across the country, they have given COVID preventives. Now, when one of my patient contracted COVID, he thought, okay, arsenicum album 30 has been given as a preventive. Why not take arsenicum album 200 when I have COVID itself? Maybe every 4 hours I should take arsenicum album 200. So he took arsenicum album 200 every 4 hours. And he did not know that arsenicum album 200 is not to be prescribed in a case where they have a cardiac issue and where the patient is in a critical condition. So he is already a cardiac patient and in a very bad shape and is on a lot of supportive medicines to support his heart. Without knowing this, he started using arsenicum album 200 4 times daily. And it is one of the medicine contraindicated in such patients. Not indicated. So then he was hospitalized and they called me saying now what to do. So that's why never self-medicate. It might be homeopathy doesn't have any major side effect if used in healthy people. But for people who have major health issues, please don't use left and right and then end up in a complication and then say that okay, I got a side effect of homeopathy. It's not a side effect, it is because it is not used in the right way. When used in the right way, it will not harm you, but it's always better to consult a homeopathic doctor to take your prescriptions. So I don't like to suggest any one medicine for any particular condition. It's always better to symptomatically deal with the case.